Yes. Yay. So we'll start with this. Hey there, everyone, and welcome back to Nature's Divine Healing on Demand, a YouTube channel where I talk about nutrition, non-toxic remedies, and natural remedies to promote health. Today, I'm talking about women's hormone health in a holistic manner with Dr. Rita McGuire, who is also a holistic health coach, and she's amazing. So I'm so excited to have her here, and I'm so excited to have you guys watch this video. So welcome everyone to our show today where we're talking about women's hormone health and ways to naturally treat that. I have with me today Dr. Rita. Welcome, Dr. Rita, everyone.
Thank you so much, Kiana, for having me, and welcome everyone.
Thank you, Dr. Rita, for being here. And I'm so excited. I would love to start off today's show with really just you introducing yourself and telling us about your background in medicine and holistic health.
Wonderful. So I am an obstetrician gynecologist of over 30 years. I can't believe it. I'm from Chicago, but I trained at Wayne State School of Medicine in Detroit, Michigan. I completed my residency in Chicago at Cook County Hospital. It's now called Stroger, but have always worked in the inner city in Chicago, really helping to promote awareness to teen moms, awareness to our community of Black and Brown moms and mothers and women who have not only had some issues with complications. I see a lot of high risk pregnancies, but also some GYN gynecological issues that we'll talk about today. But about 4.5 years ago is when I really started to concentrate on holistic options for my patients, because patients are looking for another tool in their toolbox. They're looking for something that's natural, organic, that they can use to address fibroids or endometriosis or PCOS or even nausea and vomiting during pregnancy. So that is something that is exciting because in medical school, they don't teach us about herbs. They don't teach us about natural healing. They don't teach us about alternatives. They teach us to write a prescription and that's it. So this has truly been a journey. And not just 4 years ago, Kiana, throughout my entire practice, I'm just so grateful that I'm that type of physician that when patients come to me and say, Doc, can I use black cohosh? Or could I take this ginger? Or can I start juicing? I've always been that physician not to quickly say no, but I've always been that physician to say, let me look up all the ingredients in this herb that you want to take to ensure it doesn't interact with your medication that you may be on. And yes, it's fine. And so I've always been that physician that has really done my due diligence. And I think that has truly been educational for me in the 30 years that I've been practicing.
Wow, that's such an incredible share. I really heard you. I heard you when you said due diligence and just really being open to people who want to try a more natural or holistic method whenever they're dealing with some of the health concerns that they might have going on. Kind of a little fun story. I have a lot of inflammation issues, and I had asked a physician once, like, do you think it would be okay if I took turmeric with my metoprolol? And he was like, well, you don't want to do that because you don't want to be a guinea pig. And I go into the latter part of the conversation because it's a little controversial. But he asked me if I wanted to sign up for this new medication that was released last year, and I was like, you know what, I wouldn't want to be a guinea pig, and so that's how I responded, and I was like, thank you, I'll be on my way. And so I asked the pharmacist, thank God. And so the pharmacist was like, honey, turmeric's been used for over 4,500 years, like go ahead and take it, you're gonna be fine. And so I was like, thank you so much. So having doctors that are willing to look into it more rather than a quick hard no because they don't necessarily know about it, is so beneficial, and it's a great service to patients as well. So thank
Yeah.
you, Rita.
And I've also been doing a lot of work with cannabis. A lot of my patients are wanting to utilize medical marijuana. And so, yes, absolutely, yes. I would prefer that my patients utilize medical marijuana than utilizing marijuana that they may find on the street, because it is regulated, tested, and safe. So, there's a lot of things we're going to talk about today, but yes, I'm a cannabis advocate. In fact, I was asked to testify in the state of Illinois for the legalization and taxation for adult use cannabis laws here. So we are the 11th state to adopt adult cannabis laws. And yes, cannabis also, along with turmeric, ginger, a lot of amazing herbs can be used as an alternative for pharmaceutical medications.
I love that you brought that up because I actually was living in the state of Indiana when Illinois legalized marijuana.
Mhm.
And so I was so close, but so far away at the same time. And so when I moved back home to Virginia that year, they legalized marijuana for medical use. And then the following year, they've made it completely legal here in the state of Virginia. And, even with the legalization of our state, I got a little bit of pushback from my physician. And so I was like, well, like these physicians that gave me this card felt like I qualified. And like, then I was extra and I sent her a bunch of articles from Google Scholar on the uses of it and like why and advocating for like my use of it. And she was a little bit more comfortable when she realized that I came from like a more evidence-based research approach, and because she tried to tell me there was no evidence for the use of marijuana, and I sent it to her. So I was like, if that was the case, ma'am, all of these states wouldn't have legalized it for medical use. Like this is the direction that we're moving.
Right. And
Let's
again, we didn't learn about the endocannabinoid system in medical school. We didn't learn about the science behind how cannabis works in our body, and the thousands of years. I mean, cannabis has been used since 2737 BC. In fact, pharmaceutical companies like Lilly, Park Davis, all of these major pharmaceutical companies utilize cannabis based medicine back in the 30s.
Oh, wow.
So, yes, this is something that, again, we're going to really have to advocate for medical students to learn about, advocate for not only medical schools, but nursing schools, chiropractor, dental, pharmacy schools. All of these healthcare professionals need to learn about holistic healing.
Yes, yes. I love that. I love that you said that. Oh, I really want to know, like, what was it that made you choose this specialty? Like, was there a moment in medical school that you were like, I'm gonna be a gynecologist? And what was that moment?
Wow. The moment was my very first night on labor and delivery. So, in our third year, we had a clerkship where we rotated through every field of medicine. And I knew that OB was absolutely not going to be a choice for me. I didn't feel that the lifestyle was something I would want, being up all night in the middle of the night delivering babies. But the very first night that I was on labor and delivery, we had a woman that came in that was on cocaine. She was abrupting, meaning that the placenta was separating from the uterus. She was hemorrhaging. At this point, she maybe was down 2 liters of blood. The baby's heartbeat was in the 60s. The baby was really starting to, what we say, exhaust itself. And the resident said, I want you to keep your hands off the surgical table until I get the baby out. He took a scalpel and the baby was out in less than 2 minutes. And when I saw him save this mom's life and the baby's life, I was like, sign me up. That was a pivotal moment for me. And so I switched from being an ER, wanting to go into emergency medicine, to OB-GYN because of that experience.
Oh, wow.
And I really loved working with women. I really had a hard time in my rotations working with men because the men were always like, you're going to do what to me? And how old are you? I was very young back then. And so I had such a natural rapport with women. And so it just was so natural. It was just so fulfilling to be able to usher birth into the world and usher a life into the world, and also to be a part of urgent, emergent, life saving procedures that are involved in OB-GYN. So I loved it.
Yeah. Oh, that story touches my soul so much. I love that story, Dr. Rita. Dr. Rita is so just inspiring. And what you said just kind of made me think about like some of the sexism in medicine and that like a lot of female doctors face. So to all my female doctors out there, go ahead and give yourself a pat on the back. Like you're doing amazing things. And I know that there's probably patients out there that are like, you got any male doctors? Like, little girl, like, get out of my face. And it's so frustrating when you're like, well, I sat through the same medical training that they did. I just am a woman, And so you definitely are changing lives and you're exactly where you're supposed to be. So I'm just so glad to have you. So I want to talk about the signs of hormonal imbalance because this could have happened to me. So in 2017, I went from being, and I was a assistant school teacher. I stopped that job and moved to Indiana to start my career as a music therapist. I was starting my internship. And from the summer to like, it felt like my birthday, I had gained so much weight. Like 70 pounds, Dr. Rita.
Wow.
It was really bad. Like my clothes just didn't fit anymore. And it was kind of a lot. I went from a size 10 to size 18 really fast. And it was really tough. And then I realized I was having a lot of acne and things like that. That was coming up with cystic acne. And I was having some muscle ache, tenders, and stiffness. And recently I was just diagnosed with tachycardia. And so increased and decreased heart rate is another sign of hormonal imbalance. Pain, stiffness, swelling in your joints, unexplained, and sudden weight loss or even weight gain, and fatigue and insomnia. And so I was dealing with these things. And you know me, I went Dr. Google style and I was like, I really think I got this condition called PCOS. And so like eventually after like a year of having it or having this stuff go on, I went to the doctor and I was in Indiana at the time. I saw an FNP. She was amazing. I wish I could remember what her name was because she was really one of the best medical physicians I've ever seen or medical practitioners I've ever seen. And I went to her and I said, I think I have PCOS. And she was like, tell me about what's going on. And I was like, well, I gained 70 pounds. I haven't menstruated in over 13 months. I have all this acne. I've got all this hair going on. I got this mustache going on. I was like, it's not fun. I was like, I'm having some pain whenever I'm intimate with my husband. I'm divorced now, but at the time. And she did the whole workup. It turned out that I didn't necessarily at the time have any cysts on my ovaries.
Mm-hmm.
She ran the blood work. And at the time, I didn't necessarily have a true insulin resistance, but she said that she thought it was weird that there was even a slight elevation in my sugar when I was fasting the whole morning. So she said that that was enough for her to be convinced. And she was like, on a clinically significant level, it seems like to me you have PCOS. Your tests may not be 100% lining up with what we'd like to see, but she was like, you have all the symptoms. You have literally all the symptoms. So I'm going to go ahead and diagnose you with that. And so I ended up changing my diet for my gut health because I have a gut problem that I've been dealing with since I was 19. And that was really kind of where the shift happened for me. And I was able to honestly lose 100 pounds. So I used to be 255 pounds. And now I'm like somewhere between 155 and 159, like just going back and forth, y'all. And so
Incredible. That's great.
it was really paleo, eating more paleo, not extremely strict. I probably should be a little bit stricter about it, but going through that framework really helped me put together a lifestyle for healing. And so I'm wondering, are there any other signs to hormonal imbalance that maybe I didn't mention that are very key indicators of something being wrong?
Yeah, there are so many signs, and you really picked up on the key ones. But um, mood imbalances,
Mm,
anxiety, depression, those are other symptoms and signs. Sleep disturbances, not being able to sleep throughout the entire night. Hair loss, hair thinning, alopecia is another sign that hormones are out of whack. And so when women have these other signs, for instance, hair loss, hair thinning, which many hormonal imbalances that relate to the thyroid, many women, especially women of color, will say, you know what? It's probably my stylist. She's probably putting too many chemicals. I'm getting too many braids, too many weaves. A lot of women will look for other reasons why they're feeling the way they feel.
right.
And many women just feel out of sort. They just come to me and say, I just don't feel well. I can't pinpoint what it is, but I'm just not myself. So, a lot of the psychological, emotional, as well as other physical signs, hair loss, hair thinning. You talked about the muscle aches and joint pains, the weight gain, the weight loss, the fatigue, um, blurred vision. A lot of times, hormonal imbalances can come with um, our vision being compromised, as well as our appetite, areas of increased appetite, loss of appetite, and then, of course, our whole metabolism.
Right.
And then the cardiovascular, those are really scary. When
Right.
your heart starts beating really fast and you're not thinking about a hormonal imbalance, you're thinking about a heart attack or a stroke, those are really, really concerning to a lot of women. And I think if you remember the story when Oprah Winfrey was going through menopause, she tells this story where she thought she was having a heart attack. Her
Mm,
heart was racing. I mean, she was breaking out in sweats and all that was is that the hormones out of balance during a menopausal state, which as you age is inevitable. Um, but we can really address those symptoms to reduce them and even obliviate all of these symptoms through our diet, through exercise, through self care, through cannabis. So many holistic ways that we can address our hormonal imbalance that I think as healthcare professionals, we need to be open to have conversations with our patients about.
wow. Oh, that was such a beautiful share, Dr. Rita. There's some comments coming in. I really want you to know that Jason Thomas from India says, powerful story, Dr. Rita, and much love from India.
Oh,
And so
wonderful.
we thank you, Jason, for watching. And to all the listeners who are watching right now, thank you so much. Oh, yes, Dr. Rita. Doctors need to be open. All medical practitioners need to be open to really just hearing what's going on and the myriad of things that can go on. I think a lot of the times what I've seen in my own experience with my own doctors is sometimes they're trying to slap the wrong label on things. I'm like, oh, this seems like a comorbid symptom of something I'm already diagnosed with. Why are we trying to relabel me with something else now? Like, we already have an
Mhm.
explanation for this. And so the conversation of there being like an interruption in the mood, and with mood disorders, and maybe even comorbidities of mood disorders with hormonal problems. And so that's a lot of things that people don't talk about. Comorbid means two diagnoses at the same time, or symptoms that occur at the same time. And so yeah, I love that we talked about that. I want to dive deep into the questions that I have for you today. And the first question I have for you are, what do you believe the number one, or the few most vital causes to these issues?
Number one is our diet. Our diet is mostly comprising of dairy and animal protein. Dairy and animal protein increase mucus production, parasites, and inflammation. And when we look at hormonal imbalance, when we look at a lot of our chronic disease states, hypertension, diabetes, heart disease, thyroid, lupus, fibromyalgia, the autoimmune conditions, it's our diet. Whatever we are consuming when we eat animal protein, we're consuming what that animal was fed. We're consuming hormones that the animal was fed. We're consuming the fear that that animal had when it was slaughtered. We're consuming the cortisol that the animal had when the animal was being slaughtered. We're also consuming a lot of food that's causing the pH of our blood, our body, to be very acidic. And when we look at, again, chronic disease states, it's the acidity that causes a lot of these issues as well. And one thing that my medical students always said, because I don't have students now currently, but had years of training students during their OB rotation. They were like, Dr. Rita, you're the only doctor we've rotated with that talk to their patients about diet. That's just so fundamental, right?
Right.
But that's again something we're not taught in medical school about teaching our patients to embrace a plant based diet, fruits and vegetables, really removing processed foods, dairy, fried food. So, animal protein, dairy, plant based diet is the number one thing that we can do to change the trajectory of our health. Number two, exercise. How many doctors talk about exercise, right? Exercise not only reduces stress and depression, it improves our mood, but it keeps our weight, it reduces our weight. And being overweight is a comorbidity that leads to other comorbidities.
Right.
Number three, sleep. Sleep is, I mean, if you don't get enough sleep, you can die. I mean, sleep is so important to keep your hormones in balance. We have something called ghrelin and leptin. These are hormones that are important in sleep that help to manage our weight, to help manage our appetite. Hydration. We don't drink enough water, right? I've got my water here with my electrolytes in it, but hydration is key to our metabolism, to our kidney function, to our liver function, to making sure that we're detoxing and cleansing. So these fundamental things make a huge difference: diet, exercise, hydration, and sleep. And they all are intimately related with hormone imbalance, intimately. We're seeing more dialysis centers in Chicago. I'm in Chicago. There are more dialysis centers than there are McDonald's and Walgreens now. Why? Because we as Americans are consuming so much animal protein that our kidney can't even keep up with it. So we're going into kidney failure. And again, we're eating so many foods that change the pH of our blood that we're faced with a lot of inflammatory diseases, thyroid, Graves' disease, lupus, fibromyalgia, arthritis, heart disease, diabetes, obesity, the list goes on, depression, anxiety. That's all related to our diet. Our gut microbiome is all related to hormones, our brain health, our gut brain axis. It's all interrelated and so easy to fix. Is it easy to do? It's not easy to do when you've been brought up and raised on meat. It's not easy to do when you've been brought up and raised on you know that we're the only species that drinks another species milk.
Yeah, doesn't make any sense.
Right, that doesn't make any sense. So, you know, I am really an advocate on changing the trajectory of your health and wellness with diet, exercise, sleep, hydration, vitamin supplementation, natural herbs, and of course, cannabis as well. All of these things collectively can change your health. It's
Yeah.
changed my health. I used to be over 211 pounds 7 years ago. And I did it the old fashioned way. I started working out and I started eating healthy. Right now, I'm a vegan. I'm going to be 60 in October. I feel amazing. I have energy. I work out every day. I'm a fitness instructor on the side when I'm not delivering babies and speaking to incredible people like you on podcasts and empowering people about health and wellness. It's just amazing. But it took some time because I was a steak. Man, I love steak and potatoes. You know, I was so bad, Kiana, that I could walk into um, Maestro's or Gibson's, which are the top two steak places here in Chicago, and I didn't even need a menu. They knew when Dr. McGuire walked in the door, it was a porterhouse, double baked, triple baked potato, apple martini, just the most unhealthiest doctor in the state of Illinois. That was me 7 years ago. But now all has changed, and I'm really teaching a holistic way and option of addressing our health.
That's so interesting that you said that, because I'll be honest with you, the last time I was in the hospital, it dawned on me that every single nurse that walked past me was overweight. And I was like, that is kind of scary that our healthcare providers aren't really leading healthy lives themselves. And I would almost argue that their work environment isn't set up for them to be healthy, because I was there for so long that I was there for two of their meals where they're ordering food,
Right.
and it's the only way that they can get something to eat is to eat something from the cafeteria or to order food. And they may not be ordering some healthy stuff. Like for me, whenever I order food, like I like to eat Chipotle because it's like kind of the healthiest option I can get. It's like some rice and some vegetables, and I still eat meat, but I don't eat it a lot of it.
Oh, we gotta get you off of meat. Let me help you. I can help you.
And so I keep
It's all about
hearing
learning. Yeah, it's all about learning and unlearning. It's really, if you really understand what meat is doing to you, you would stop eating it as often as you eat it. But it's a process.
yeah,
And I used to use the same excuse. I'm overweight because of my job. I don't have time to, but you have to make time.
gotta make
Like
time.
I meal prep. I meal prep. I'm here. I'm here at work. This is my salad. This is vegan dressing. You have to be intentional.
Right.
Otherwise, you'll order out and you'll order unhealthy.
Yeah.
So I used to use the same excuse. It's no excuse. You have to meal prep. You have to be prepared. You have to really be intentional in doing that so that you can be a positive role model for your patients. I was not effective when I was 211 pounds when I tried to tell patients to lose weight. They looked at me like this. Really, doc? You should lose weight. So I wasn't effective. Now I am.
Yeah.
And super important because Black and Brown communities, we are still dying prematurely from preventable diseases.
Yeah. 41 million people die a year from chronic illnesses, chronic conditions. And I was on Clubhouse the other day and I said, I don't have an MD, so people don't always respect what I have to say. But I've read a lot. And so I said to them, like, everything always comes back to inflammation. And
Oh,
I had people leave my room because they didn't want to hear that. They want to hear, oh, I have this problem because it's genetic. Oh, I have this
oh,
problem because my mama had it. It all comes back to inflammation. And
yeah,
inflammation always is connected to what we're consuming.
right.
And so,
Obviously, if your mom, like my mom, unfortunately passed away from coronary artery disease, heart disease, if I incorporated the exact same
life,
lifestyle as my mom, I will have it too. It's not that it's genetic, it's epigenetic, it's learned bad behavior of my mom. My mom would literally eat a butter sandwich,
oh wow.
butter with bread. So if
Oh,
I lead that same exact lifestyle, I would too have heart disease. But I made the decision 7 years ago that I was going to live for my three children. I would be a positive role model for my community and do better. And unless you know to do better, you do better. If not, you continue that same journey. So that's
yeah.
really, really important.
I'm so glad that you said that about epigenetics and the learned behavior because even once someone got onto one of my posts and was like, how dare you tell people that they need to change their lifestyle? Some of this stuff is just genetics and they need their medications. And I was like, I just sent them like 6 journal articles from where I was like, here you go. Here's your evidence based research that, honey, it's not your life, it's not your genetics that's the problem. It's the lifestyle that's been handed down to you through the culture and stuff like that. And so, my next question for you is, how do these imbalances lead to conditions like polycystic ovarian syndrome, also known as PCOS, and endometriosis? And if there other conditions as well that maybe I didn't mention that can come up that you see that these hormonal imbalances tend to cause?
Right. So hormonal imbalances deal with our endocrine glands. So we've got a lot of endocrine glands. We've got the pancreas, the pituitary, the pineal, the thyroid, the adrenal, the ovaries, the testicles in the men. And all of these organs are in communication with the hypothalamus, right? It kind of starts in the main center in the brain, the hypothalamus. And whenever there are something as simple as stress, when there's something as simple as inflammation, something as simple as our body thinking that an organ is foreign, that's an autoimmune, like Graves' disease. This is what causes a hormone imbalance. Along with that, the air we're breathing, the food we're eating, the water we're drinking, full of uh, toxins and pollutants, and all of these external environmental stresses can cause hormonal imbalance, along with the change in women called menopause, the change in men. Yes, men, you have something called andropause, right? It is a rapid decline in female or male sex hormones that can cause hormonal imbalances. So, all of these factors together, diet, environmental, normal aging process, can have an impact on hormones. And that's why when we think about changing a hormone imbalance, yes, traditionally there's medications, Synthroid, Metoprolol, uh, insulin, and there's also the ability for you to do that naturally. I am not advocating for anyone to stop taking their medicine. I was trained at a Allopathic Medical School, Wayne State School of Medicine. Never, ever would I advocate anyone in stopping their medication. You need to work with your physician to reduce or maybe even come off of medication slowly. And if you don't have a physician that is willing to work with you with some holistic ways of addressing your health, you need to find another physician because there are many physicians out here. There are functional medicine physicians, integrative medicine physicians. There are MDs, there are naturopaths, there are chiropractors, there's all sorts of healthcare professionals that are very, very competent, but also understand the role of holistic healing as well. So I always tell people don't be afraid to find another doctor. Don't be afraid. It's your body. But I also want you to be safe. I don't
Right.
want anyone just stop taking their medicine and start taking turmeric or ginger instead. I want you to do it safely. But
Right.
again, there are many, many physicians out here that are willing to work with you. Physicians that are cannabis advocates, physicians that are natural herbal, have gone to school and done extra certification. So don't be afraid to do that.
Yeah, I love that you shared. Like sometimes if the doctor's not working, you got to get a new doctor. And so that's very, very much so. Jason's saying so many great things. Dr. Rita, you're
Oh,
amazing. What an awesome topic of discussion. I appreciate you being here on Kiana's show and sharing your knowledge and wisdom.
thank
Thank
you,
you.
Jason. I really appreciate that. That means a lot. That means a lot to me.
Yes. It's so funny. I'll be honest. I'll tell it all right here, Dr. Rita. I used to be on 13 medications that were twice a day. And it was a lot. I was being treated for hypertension, for depression and anxiety, for like I had all this other PCOS stuff going on, birth control, all this just it was too much medication. I have ADHD. So it was like too much to keep track of. Like I had a box with like the Monday and Tuesday, and I'd be like, is it Tuesday? Was this Tuesday left? It was just too much to take care, too much
Oh
to keep
my
track.
Lord.
This is going to sound crazy and wonky and woo woo to a lot of people. But when I dived into the spiritual health piece, some of
Mm,
the anxiety, depression, existential crisis started to go away. My mind started to be more clear. I was able to then get into therapy because I was ready. I was in a place mentally to hear a therapist and to share my story with a therapist. Through that, through the spiritual work and the mental work, then I realized like, oh, wow, I don't need to take these meds anymore. So I ended up stop taking my medication because, well, the high blood pressure medicine I was on really wasn't working for me. I ended up in the ER because I thought I was having a heart attack back in
mhm.
last April. And they, I won't get into that ER visit because it's a whole nother YouTube video. But after I fought the doctor into checking my heart again, they did realize that something was up, and I ended up spending 4 days in the hospital, and they did a full workup and decided that they felt like I just had like a heart spasm paired with tachycardia, and they felt like maybe that might have been what was causing my troponin level to trip at a cardiac level of care. Well, that's when I got put on the metoprolol, and I was talking to my doctor, and they were like, you know what, this metoprolol is going to handle your hypertension, it's going to handle your anxiety, it's another treatment for your PTSD, and it's going to handle this tachycardia. So it's funny because I got on this one pill and it's finally handling all the problems that I had. You know what I mean? Just having that one doctor kind of pinpoint that one issue. And so it's funny because I did never advocate for people to stop taking their medicine, but for me, I felt like I needed to. And it was through doing that, I ended up getting on the right medication that I
Wow.
needed to be on. And so even that cardiologist, he told me that he believes that if I keep focusing and doing the things I'm doing, that I can one day come off of those beta blockers. I might be able to control my heart rate more naturally. So that gave me a lot of hope, right? He doesn't think I'm going to need these beta blockers for life or anything. And a lot of times you hear doctors are like, "Oh, you just need this; it's genetics." Like, you know what I mean? Like that's
Right.
what I heard when I was 24 years old and placed on high blood pressure meds. the feedback I received was, it's not your fault, it's genetic. You're black, and this
Right.
is more of a problem for people of color, and blah 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 blah. And so it was kind of discouraging, like, wow, I'm going to have high blood pressure for the rest of my life. And that cardiologist was like, he was like you, he was like, go plant based, like he was like, focus on what you're eating, and it's
Those
going to.
are my favorite people in the world, are cardiologists, because cardiologists absolutely understand that plant-based diet will decrease your heart disease risk by 40%. And they really push that. They push their patients to be plant-based. So I really do love them. And they have evidence-based, so much evidence-based research on plant-based diet and improving and reducing your risk of heart disease. I didn't mean to cut you off, but I
Oh,
love
no, it's
cardiology.
okay, because heart disease, every, like, 20% of the U.S. population will die from heart disease.
Mhm.
Yeah, another 20% from cancer, and all of these come back to what? Diet,
Yep.
nutrition. And so it just really speaks to the fact that there's a nutrition issue in the United States, which we could go into a whole nother episode. But yes, Dr. Rita, I love that. I want to ask you another question. Okay, I wanted to ask you about the key differences in diagnosing PCOS versus endometriosis.
So PCOS is more of a laboratory diagnosis. There is an imbalance of LH to FSH and progesterone. There's also some imaging studies that are done where you may see multiple cysts on the ovary, as well as your clinical features. Endometriosis is a condition where there is a triad of painful menstruation, painful intercourse, and infertility. Endometriosis is a result of menstrual blood not coming out of the vagina, but going back through the uterus, through the tubes, and implanting on different pelvic organs. Implanting on the uterus, implanting on the ovaries, can even implant on ligaments in the pelvic area, can cause extreme pain, infertility, and painful intercourse and painful periods. PCOS, on the other hand, doesn't give you that sort of pelvic pain, but causes a lot of issues with weight gain, causes issues with insulin resistance, issues with infertility as well. But definitely, it is a diagnosis that's very distinct and different. Endometriosis, we usually diagnose this with doing a laparoscopic procedure where we take a telescope, we look inside, and we see the implants. We burn them, we remove them, and typically a woman can get back to normal. Sometimes endometriosis is so bad that a hysterectomy is warranted if you are not of childbearing age at the time. PCOS also is treated with birth control pills. It can be treated with metformin to help the insulin resistance to be in balance. And it can also be treated with diet. Both conditions can be treated with diet to reduce inflammation and to bring those hormones back in balance. So hopefully your viewers understand the difference. I know I was jumping back and forth, but both conditions, endometriosis and PCOS, is a very common GYN condition that we see in our practice, and it can be very difficult to treat as well, but
Yeah.
not impossible.
Yeah. So, what I heard you say was, that endometriosis is typically diagnosed through laparoscopic view of the pelvic region, and by cauterizing anything that you find in there, and sometimes hysterectomies. And then PCOS is done through lab work and some ultrasounds to see if there's any type of cysts and things on the ovaries and things like that, looking for insulin resistance and things like that. So I think that you broke it down for us, Dr.
Okay. No, I think that's Kiana. You are just So incredible.
I know some things. Some of my
Yes,
friends are like,
you
you should
know
have
a
went to
lot.
medical school. And so my mother is so mad at me because when I was in high school, she wanted me to be a nurse. And I was like, oh, I'm going to be a music therapist. It'll be fine. And so, yes. And so I wanted to talk about holistic health methods that we use to combat these conditions. We talked about diet. We talked about exercise, prioritizing your gut health through really watching that microbiome, eating those fruits and vegetables that are full of fiber and things like that, but also making sure that you get probiotics, prebiotics, and prebiotics is basically fiber, y'all. Probiotics, and I just learned about postbiotics. I'm always learning something new, and so
Nice.
yeah, and so prebiotics, I'm always preaching, guys. Please don't go to Walmart and go buy a bottle of amphisyphilis or whatever. Like, please just,
Acidophilus, yeah.
yes, thank you. It's like, please, 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 just go grab some kombucha in the
Yes.
aisle, and like, or grab some kefir water. Those are that way you get more different types of strains of bacteria in your gut and not just one specific one. Because unless you had some sort of, what do they call, some pathology report to see which particular bacteria you were lacking, you don't want to just prescribe yourself one particular bacteria to stick in your gut, because what's going to happen, it's going to be very similar to what they tell us about antibiotics. When we
Right.
take an antibiotic when we don't necessarily need it, we build up a resistance to that particular antibiotic. And the same thing happens with probiotics as well. So making sure that you get a varying different variety of bacteria in there. I'm going to go back to my list here. Protecting your gut health, prioritizing nutrition, making sure to sleep, exercising daily, and then foods for hormone health. I have cruciferous vegetables, good fats, rainbow vegetables, quality lean meats if you still eat meats, organic, y'all, organic without the
Grass fed, organic.
yes,
Yes.
yes. If you're
Absolutely.
gonna still eat meat, or just making sure that you have a protein source at every meal for my vegan folks out there, and then whole fruits in moderation, plenty of fiber and vitamins, including B12, 6, C, and D, magnesium, iodine, and selenium are some other minerals that we need to for hormone balance. But are there any others, Dr. Rita, that you think?
I think you hit it all, making sure you said vitamin D, right? You said zinc, the vitamin Bs, all of those are super important, and they can be found in your fruits and vegetables. And I really advocate juicing. I juice one meal a day. It's usually breakfast. I have a cold pressed juicer, the Nama, and I love that because it really gives me all of the nutrients and vitamins for that meal, that I know is going to fortify my skin, my nails, my hair, my gut, my brain, and my hormones. It's like it is just so comprehensive. So um, think about, listeners, investing in a juicer, getting those fruits and vegetables in at least once meal a day with those juices. You don't have to go organic. You don't have to go out and buy all organic fruits and vegetables. That's super expensive. Start easy. Celery, I love. Carrots and the apples give you fiber, and then the dark green. I've really fallen in love with chard. I think it has a more robust taste than kale, and spinach. So, yeah, get those
Amazing.
juices in.
I love that. I need, so takeaways for Kiana here. Maybe I'll start juicing. I'll reconsider veganism. I'll be honest with you guys. So I used to be married, and my ex-husband was a vegan at first when we first got married. And I tried to be vegan for a while, but then there was this instance where I literally had a nervous breakdown, and I started screaming and crying about how bad I just really wanted some chicken. And then, like, I was toughing it out. I was being a vegan. And you know what? I found a bucket of KFC in his car. And I went into the house with this bucket. And I was
Oh
like,
my gosh.
I haven't eaten chicken in so long. And you are secretly eating meat. I was like, excuse you. And so,
Wow.
and so that's when I started eating meat again.
I see. Yeah,
And
I mean it's hard. I was a vegan 7 years ago, and then a chicken wing fell in my mouth. And so I've been a vegan for 6 months now, and I feel amazing. I did a 21-day cleanse, uh, a raw vegan cleanse, and that is what
kickstarted it.
prompted me to be a vegan again because I felt amazing. I felt, when I was 21, I felt really good, and that is what I felt like. I felt like I was 21 again. I was like, I don't want this feeling to ever go away. So I feel amazing. I'm sleeping, my anxiety, stress level is down, my energy level is up. It's just something that you have to be open to try. And when you try it and you're honest with yourself, you'll feel great. So,
Yes, I love that. I'm going to reconsider those things because you have inspired me.
yeah, and definitely if you're on the line and you're a woman and you're having issues with hormonal imbalances, or maybe you're a male on the line and you're having issues with hormonal imbalance, it doesn't need to be a woman to have your hormones out of balance. It just is absolutely a way to get your body in balance, okay? What we call homeostasis. And we want to be in a good pH level, we want to be in a good hormonal level, and we just want to be overall in a better space.
Yeah, mentally, physically, and spiritually, right? And
Yes.
so it's so important. And I love, love, love that you said everything that you've said today. I feel like we are like kindred spirits.
Yeah,
I just
absolutely.
love it. So, my last question for you is considering the fact that there are healthcare disparities, it's particularly for women who look like you and me that may not come from a good socioeconomic background. Maybe they are on Medicaid, maybe they don't have any insurance at all. When they go to the doctor and they take these concerns, say maybe the doctor's not hearing them, what are some ways that they can speak to their doctors so that they'll listen?
Well, I want to first say before I answer the question is that in Chicago, in the inner city where I practice, there have been 4 hospitals that have closed their labor and delivery units. So where do these moms deliver? Right? There's research, evidence based, that women who are not able to deliver in their community have poor outcomes. Research that shows women that are not cared for by healthcare professionals that look like them have poor outcomes as well. So the health disparities are real in the areas I practice. And I always encourage patients who may have had another healthcare professional and they come into labor in our hospital. I always empower them just to ask more questions because many times we have the scenario where a healthcare professional will just dictate and tell a patient what the plan is going to be.
Right.
And we have to, and I really encourage them to ask, well, why are you inducing my labor? What is the reason for the induction? What are the complications that I'm facing that is causing you to induce my labor to make my baby come out at 35 weeks instead of 40 weeks? That's just one example. So it's
Right.
just opening your mouth and asking questions. Many times we take it for full face value, that what is told to us is what we have to do. And that's absolutely not true. So ask questions and then utilize the ancillary staff. Utilize that nurse. Ask the nurse questions. Ask the PA or the nurse practitioner or the MA or the, whatever other healthcare professional is in that environment, seek out um their ability to be an advocate. And it's a real problem. And many times I find it's because patients are just not asking the question.
Yeah. Well,
Questions,
yeah.
questions.
So I
And
think
they'll come to me and I'll ask them, well, why are you being induced? Why did your doctor send you here? I don't know. Did you ask? Nope.
a lot of people don't think to question the doctors because we kind of hold them high esteem here in our
Mhm.
culture. They go to school for over 8 years and they do a residency, and we kind of look to them as like they're these great experts and we shouldn't question them. And then sometimes I've even found that the doctor will be like, "Why are you questioning me? You're not educated enough." Like they'll treat
Oh
me like,
no.
and then and so I'll be like, well, I'm questioning you because it's my body, right? Like I'm the one who has to live in it, right? And so I found that for advocating for myself, being able to dictate exactly what symptoms, how they occurred, utilizing their pain scales that they use in the medical system, like going online, being like pain scale, so that you can say whether it's mild, moderate, or whatever, describing exactly what the pain felt like or whatever symptom that you're having, what time of day it occurred, what did you eat, what happened around that, taking detailed notes about what's going on with your body so that when you go to the doctor, you can say, well, for 3 weeks straight, I've been dealing with this 3 out of 7 days of the week. So
Yeah.
they can see that there's some data behind it, taking some data. Another way is by preparing your questions before you go, writing down like, what are some questions I need to ask my doctor before I even go into my appointment, and take them, put them in your phone, y'all, the notes section in your phone, and have them ready. I've been putting my doctors on trial. They don't like that. But so, I'm like, isn't it true? Like, and so I always come prepared. And then another thing that you can do to speak to doctors will listen is get a second opinion. Like Dr. Rita said, like if you don't like what they had to say, go find someone else.
Yes.
Go find someone else who will listen to you. And that's kind of where I'm at right now, trying to find people who will listen to me.
Yeah. Yeah.
So
And I
because
love that. And don't be afraid to seek out specific types of doctors. Any physician that has a integrative or functional medicine certification is that doctor that is going to not treat your symptom, but really get to the core of the pathology of what's going on a cellular level, right? Not just going to give you a band aid prescription, but find out that, oh my gosh, it's really a zinc deficiency.
right.
And that quickly replacing zinc, now the stiffness and the swelling in her joints have disappeared. So don't be afraid, like Kiana said, to seek a second opinion, but be intentional about seeking out those physicians or healthcare professionals that have more of a holistic background and certification. So, those are great points. I love that, Kiana. Yeah, being
I've been on
prepared.
this
Write down your questions. Be prepared. Don't be intimidated. It's your body. This is my body. And taking copious journaling notes about your symptoms. Like this happened. I love that. On this day, my period was heavy. I passed clots. I mean, be really specific so that healthcare professional can see that you have been taking um, notice on what's going on.
Yeah. And I think too, from a doctors are very researched, evidence-based minded people, and when you're able to present them with some type of data, whether it's by numbers or they can really see like, oh wow, like this has been going on for this many days, like this is kind of a problem, it's a little bit more tangible for them than just hearing you say, well, I have this problem a lot, well, this is kind of reoccurring for me. Well, they're like, how much is a lot? Like, you know what I mean? Like, what does that really look like? Is it happening every other month? Is it happening every month? Is it happening every week? Is it happening every day? And so, really being able to provide them with some sort of data to back up what your claims are, so that they can see, like, oh wow, this is occurring so much that this person's taking notes on it every day. And yeah, I've been on a journey of self advocacy because I live in a rural area that is predominated by a particular medical um, corporation. It's a
Mm,
nonprofit, but it basically owns all of the healthcare options in my area. And
wow.
so it's a little bit frustrating because when you are seeing a problem from facility to facility to facility, that basically lets you know that the fish rots at the head. You know what I mean? The problem is up top, and how probably the billing practices that are trickling down that are causing these biases. Like, they're pushing these doctors to see as many patients as fast as they can. These doctors are just trying to, that when they hear you got something chronic, they're like, oh Lord, this is longer than a 15 minute. Like, I
Right,
gotta get out of
right,
here. Like,
right.
like, I gotta get out of here because I got another person. There's a whole long list, and we're backed up. And so they don't have time to sit there and listen to like your chronic issues when they only have 15 minutes to
Yes.
see you.
I
And so,
used to work for an organization like that. It was horrible. Unfortunately, I got fired because I absolutely would not do that. I would not herd in patients like that. I took my time. And as an OB-GYN, we have procedures, endometrial biopsies, colposcopies, implants. I mean, there's no way that you can do procedures and see patients in the time allotted. So, yeah, I
yeah.
understand. And that's bad.
Yeah. And so being aware of these things and advocating for self patient advocacy, getting patient advocates, reaching out to anybody who can just really be a support for you. And so, yeah, but that pretty much wraps up what we had to talk about today. I just want to take some time to throw Dr. Rita some flowers and just clap for you.
Yeah.
I'm just so grateful to be connected with you. And I want to promote your 45-day total transformation for women and men over 50. It's a 45-day mind body transformation challenge. It is in the link of this description. Please go check out Dr. Rita and work with her as well. And also, y'all, I'm hosting a webinar this month on March 24th called Medicine versus Nutrition: Why Eating Healthy is Essential. And so I would really love to see you out there. Come on down. And yeah, I'm super excited. If you need some help building a lifestyle around balancing your hormones or any chronic condition that you may be having, feel free to book a 45-minute strategy call with me to look at your lifestyle and see how we can help you. But that basically brings us to a close today. Dr. Rita, do you have any closing remarks?
Well, thank you so much, Kiana. This has been such an incredible time spending with you. I'm grateful that I was invited to share, to really empower each and every one of you on the line, on the social media platform, in understanding that, yes, there is a holistic way of addressing your hormones. And we want to continue this dialogue with advocacy, with health disparities. That's super important. So, all of these things, I want to thank you for including me on, and I hope to spend some more time with you in the very near future.
Yes, Dr. Rita. Jason says thank you. Thank you so much,
Thank
Dr. Rita.
you, Jason.
He's so loyal, isn't he?
All the love from India. Thank you
All
so
the love from India. And so grateful for Jason. So grateful for you, Dr. Rita. And to the listeners of this beautiful show, thank you for tuning in to Nature's Divine Healing on Demand, where I talk about how to heal the body through nutrition, through non toxic living, and natural remedies. It was so great to connect with you guys. And until next time, goodbye.
much. Bye. Thank you so much.